네, 안녕하십니까. 대구 스마트치과의 이재욱입니다.
Greetings, I am Dr. Lee Jae-wook of Daegu Smart Dental Clinic. Today I want to talk about how to place implants in the case of bone defects. I want to talk about ridge split technique and ridge expansion technique, which can be used when the ridge is extremely narrow. Let's look at what the narrow ridge is and how ridge split technique is done. Also, a set kit which allows for easier ridge split will be introduced. Because of time constraint, we will not be able to address everything, but I'm going to talk about how ridge expansion is done and how the kit is used. These will be addressed in the master course. First, in the case of narrow ridge, how are we going to proceed with surgery? I'm going to give you a background on this. The definition of narrow ridge. Is the ridge just narrow? The standard is slightly unclear. You need to think of whether the ridge can support the implant size which is going to be placed. In general, there needs to be at least 1.5 millimeter of bone buccally and 1 millimeter of bone lingually. If such requirement is not satisfied, then it can be defined as narrow ridge. There are many reasons where it results in narrow ridge. Aging after extraction and destruction of surrounding bone tissue. This can lead to a narrow ridge. Let's look at how much width is required to perform surgery safely. In the posterior area, in order to prevent vertical bone loss, there needs to be at least 1.5 millimeter of bone buccally and 1 millimeter of bone lingually. Depending on the implant to be placed in the posterior region, the definition of narrow ridge can differ. In the table, there's 3.5 to 5.0 diameter implants. But in posterior region, we can not place 3.5 millimeter implant. Let's look at 4.5 and 5.0 diameter implants. If you add the minimal residual bone in the buccal and lingual area, it's going to be 2.5 millimeters. This is going to be the minimal thickness. If you want to place a 5.0 millimeter implant, then you need to have at least 7.5 millimeter width. Then if it is below that, it is narrow ridge. In the case of 4.5 diameter implant, there needs to be at least 7 millimeter of horizontal bone mass. In the case of anterior region, this criteria changes. In the case of anterior region, it is important to maintain vertical bone height, but aesthetic factors cannot be overlooked. Therefore, 0.5 millimeter is needed even more. There needs to be 2 millimeter of residual bone labially in order to provide aesthetic implant prosthesis. Compared with the posterior region, the criteria for narrow ridge becomes more strict in the case of anterior region. In the case of anterior region, not a lot of load is applied, therefore the diameter of the implants tend to be smaller in most cases. So adding 3 millimeters, you need to think of the horizontal bone mass depending on the implant you choose. This is the residual amount that is necessary. If it is narrower than that, then it can be classified as narrow ridge, and additional actions need to be taken to place the implant. Then what kind of actions can we take? Largely can be divided into four. Today, we're going to focus on ridge split and ridge expansion. Let's take a closer look at each. If there's a narrow ridge, there's going to be 1.5 millimeter here and 1 millimeter bone here. In order to secure this width, perhaps we can reduce the diameter of the implant. We can use narrow diameter implants. Then, the degree of difficulty will become easy. However, if that area needs to bear load or if it needs to be used as abutment and requires more strength, we cannot use narrow diameter implants in this case. In order to augment the bone width, a block bone onlay graft may be necessary, or selectively GBR can be done. This is going to be addressed today, but you can also use ridge split to secure this thickness. Many people find it difficult, but if you choose the right case and proceed appropriately, then the procedure will not be as difficult. What is ridge split? Literally, you split the ridge. In orthognathic surgery, called SSRO, you split the ramus. In the same sense, we split the narrow ridge and make implant placement. This is ridge split. If you just widen it rather than splitting it completely, it's going to be ridge expansion. There's asset kit dedicated for such procedures, and this will be addressed in a little while. The pros of ridge split. GBR block bone graft have been mentioned. Why should we do ridge split? Why is it important? This will be addressed again later, but if you do ridge split on both sides, there's going to be cortical bone. Be it GBR or block bone graft, it's going to be extra bony augmentation. If you do a ridge split, then the socket will become intraosseous defect. Naturally, ossification and bone quality will become better. There are clear pros for ridge split, so if you learn about it and apply it in an appropriate case, then you get good results. Even if you find that procedure daunting, by understanding what kind of pros and cons this technique has, you'll be able to upgrade your clinical treatment. Even if you don't use it, if you understand the concept of it, it's going to be of help. Yes, there's con. Unwanted fracture can occur. As we proceed ridge split, at times this cortical bone may fracture, or the surgery itself may become impossible to proceed. In that case, you may be able to apply GBR or block bone graft. If you understand these procedures, then you'll be able to respond to it and proceed with ridge split without being afraid of it. And you may be able to achieve somewhat of a success. When you do ridge split, these need to be taken into consideration. The indications and contraindications will be addressed. ridge split needs to be done, so it needs to be thin rather than thick. If you look at the base of the ridge, this is where bending occurs. Rather than having narrow basal bone, if basal bone is wide, then it can have more resistance against a fracture when it is bent. In other words, the basal bone should be wide and the top part of the ridge should be narrow. Because it needs to be expanded, if there is sinus below or nerve, then it can be difficult to perform ridge split. In my case, I don't do ridge split a lot because there are many good methods to provide treatment, but if the case is right, I think I would be able to perform ridge split. In the case of upper anterior, there is no major anatomical structure, and the ridge has distinctively wider base. Therefore, ridge split can be used to get good results. To compare the four once again, the easiest way to place the implant is to use a narrow diameter implant, but this is not something that you can do all the time. In this case, you need a membrane here, and this would also require a membrane over here. In the case of narrow ridge, there are rarely cases where only this area is thin. It is evenly thin in most cases. Because you're doing graft outside the bony wall at times, it may not be easy to get closure with soft tissue. In the same sense, in the case of GBR, such efforts may be required. Because this is exobony defect, rather than just doing simple GBR, you need to augment it using titanium mesh, so it may complicate things even more. Do the right case selection. In the case of ridge split, it becomes intra-bony defect and ossification can occur more fast. The border will look as if autogenous bone graft has been performed because the border has been shifted and no other changes have been made, and it can be more favorable to healing if you have good case selection. It can have many advantages compared with other two methods. And you can overcome various obstacles using different techniques, so you don't have to completely remove ridge split off the table. You can attempt it, and if there is a fracture, then you can utilize block bone graft or use GBR using titanium mesh. You can make such attempts by using these different techniques. To do ridge split in a traditional way, you need osteotome. This is quite sharp. If you take a closer look, there are different sizes gradually increasing. So you can increase the ridge gradually. This process requires melting, therefore the patient can complain of discomfort. In order to overcome that, Ostem has developed asset kit. Asset kit looks like this. It has these kind of tools, and this is one set. Saw is here. As if marking the ridge, you can split the ridge, and using expansion drill from thin to thick, you can continuously expand the ridge and proceed with surgery. Comparatively, you can do ridge split in a comfortable and safe manner, so this is recommended. To briefly look at the process, because you need to do ridge split, basically, the alveolar bone is going to be thin. If it is too thin, then it may be difficult to do a ridge split. Using denture burr, you can make the top part more flat. And the site where implant is going to be placed is marked using twisted drill. Then you prep the area where implant is going to be placed using a disc, as if connecting the dots. Split is done. Expansion drill is used from thin to thick. The size is gradually increased and a split is done. And you choose the implant diameter according to traditional procedure. Once the ridge is split, at times there can be difference in height, and you need to do bone graft in that area and add membrane. And following the conventional procedure, you can do suture. The ridge split technique is quite complicated, and I cannot address everything online. I believe I will be able to go into more specific detail in Master Course Advanced Surgery part. There's a Korean proverb saying, "One picture is worth 1,000 words." I want to say, taking action is worth 1,000 times of seeing. Rather than watching 100 times, by practicing yourself, then you'd be able to get a better understanding of it, and you would be able to understand the advantages of ridge split thoroughly. Thank you for watching.